Welcome to this YouTube channel. It's a space for healing, and I'm excited about this series that we're going to be producing. Health conversations that will transform your life. So it means that if you care about your health, you know that your health is important to you. I mean, they say health is wealth. So you want to stay stuck to this channel. What you have to do is click the subscription button and so you don't miss anything. This series, we're going to be bringing diverse health conversation with a very regular face here who is a health professional, and we're going to be dealing with all of this. Today, we'll be discussing urinary tract infection, and I have Prince Will Heaven Knows. Thank you so much for coming.
Hi.
I mean, I'm so excited.
It's always a pleasure to be with you, Queen.
All right, I'll just tell you something. We do this on the radio and we're taking it off the radio and we're doing it for you to have access to on YouTube. Isn't it wonderful?
Definitely, you know, it brings the goal out here, you know.
Yeah, Thank you once again.
A pleasure, always a pleasure.
All right. Some years back, I was doing someone's hair, I was styling his hair, and then he was talking to his girlfriend that, hey babe, you need to test for UTI. I've heard that before, but he said, you know, this thing's prevalent with you girls, so you need to go check. And I was like, oh, prevalent with women? Okay. So I started doing my research on UTI and tried to be a little more careful as a woman. But I think that this is a very timely conversation for a lot of women, because you want to know how you should protect yourself from urinary tract infection. I mean, stay safe and stay healthy. Prince Will Heaven Knows, what is UTI? Okay,
so urinary tract infection, that's UTI. And if we break the words into two, if we break the phrase into two, urinary tract, the tract or the channel for urine to come out, that's urinary tract. And then the infection, like the harmful microorganisms or the harmful, so small, minute organisms, living things that, you know, penetrate and cause harmful effects to our body. So urinary tract, if you picture the urinary tract, you see that comprises of the urethra, the exit part of the channel. Then as you're going up, you see the bladder, you see the ureters, and then you see the kidneys, right? So if we divide this into two, we see the lower urinary tract, then you see the upper urinary tract. So if you're coming from down, we'll get at the point of the bladder, so we see that as the lower urinary tract. Then above that, see that as the upper urinary tract. The kidneys down to the kidneys, right? So when a microorganism, it could be something that was not harmful in another place, but came to the urinary tract, that channel, and then it's not harmful. Harmful meaning it's reproducing, and it's, you know, in fact it's living there. It's producing toxins that are affecting the consistency of that tract. So when this happens, we say that, oh, you've come down with a urinary tract infection. So it could be a normal microorganism that exists in other tracts of the body, like the gastrointestinal tract or anywhere. Then it comes to the urinary tract and then it becomes an infection. Well, it could be just a normal harmful microorganism that comes to the urinary tract. So you come down with a urinary tract infection. Well, urinary tract infection, it affects women the most. I mean, as a woman, you're most at risk. I mean, that's what it is, right? Yeah, that's what it is. It affects women the most. Why is that? Why are women at risk the most of UTI? Why? I don't think you people should panic. It's not something to panic, but it's explainable. Because of the, you know, consistency and the way the female genital tract was made. So if you start from the anatomy, how is the female genital tract shaped? If you look at the urinary tract, right, you see that the most external part or the most distal part, that's that urethra, is shorter for a woman than for a man, right? So the fact that it is shorter, it's more prone for organisms to go into. Not just that it's shorter, it's also kind of enclosed in very, very proximal to other tissues in the genital area. So so if there is a sort of an infection in the genital area, since it's very close, the infection could rise up. And then if there's from the anus, a microorganism is more prone to go from the anus into the female urethra, right, because of the shortness. So anatomically, yes, women are more prone, one. Then in the consistency of the genital tract, right? If you look at the female genital tract, you notice that it is thinner. One, thin, meaning that the inner lining, the mucosa, the inner lining, and the layers are thinner.
Yeah.
So and then it is richly supplied with blood vessels, right? So the fact that something or an organism could easily penetrate and enter the blood vessels, right, and then cause a systemic infection.
Yeah.
And so another reason, possible reason why the women are more prone to infections, not just urinary tract infections, also sexually transmitted infections, because there are certain receptors
Yeah.
that are more common in the female genital tract, and that's why women are more prone to HIV, because
Did you hear that? I had to cut him. Women are more prone to infections, more prone to HIV.
the HIV part is that the CD4 receptors, right?
Yeah.
They are more diffuse in the female genital tract, so the HIV microorganism could easily bind on them,
Yeah.
start replicating, and then go more systemic due to the thinness. And then you know the women, they are because of how thin it is, it's more prone to bruises,
Yeah.
and others are like penetrative channels that microorganisms could pass through. And then if you look at the consistency, it's from a grade of 1 to 10, it's like 3
Yeah.
when it comes to being dry. So it's like 3, so it's naturally not so dry, and then it could be like a culture for normal organisms to be there.
Okay.
That is part of our normal flora.
Yeah.
But when these normal flora ascend to the urethra,
Yeah.
they could make you come down with urinary tract infection.
Wow. Now I'm thinking, this is why God created the woman to be so delicate. I mean, so you're supposed to treat yourself as soft and as important as possible, because see, you're prone to infections, prone to UTI. You have to be really careful. How dangerous are UTIs? Or is it an or is? How dangerous is UTI?
So if you look at the complications that
Yeah.
UTIs can cause, then you can see how dangerous it is. So if you picture we divided into upper and lower genital tracts, so you notice that if the infection ascends and it goes more, if it goes higher,
Yeah.
so the higher it is, the worse the prognosis, right, and the more severe the complications are.
Yeah.
So if we're looking at how low it is, and then if it's, let's say, urethritis, that's inflammation of the urethra,
Yeah.
and so the complications, or cystitis, bladder, and then it goes up, and then when it ascends to the kidney, pyelonephritis. So pyelonephritis now is a very, very severe one, because it could lead to, it's one of the causes of kidney failure. It could be, and then it's more when it ascends higher, and then it is more systemic, you have more severe symptoms.
Yeah.
So it's UTIs are, should I say, a common cause of concern for the general public,